So, welcome everybody, and thank you for being with me this morning. I look forward to speaking with you and from hearing from all of you as well. So, I'm going to share my slides. Come on. Why are you not sharing? All right. I have no idea why my slides don't want to share now. We tested this and it worked.
Yeah, we just had it working a minute ago.
There we go. Okay. So I'm going to talk about how to get the most out of your healthcare visit and navigating it, and how to get what you need. So if people want to put something into the chat about about what has been your greatest frustration or concerns about when you've gone to a doctor's visit. So let's see, why am I going backwards? Well, I'm not seeing the chat here. So that's one of what I'm trying to see. So Matthew, maybe you can see if anybody's put anything into the chat for me. I'm not seeing it.
Okay, well, I'm putting a comment in myself. Hopefully I'll get everybody started.
So while you're doing that, I can say one of my greatest frustrations, there I can see the chat now. It suddenly came up for me. Look, doctors looking at computers the whole time instead of the patient. Yep, and hopefully I'll address that a little bit. One of my greatest frustrations is wait time. And sometimes things don't go as expected, but I want to be kept abreast of what's going on. I remember a number of years ago going to an orthopedic appointment with my son and sitting there and waiting and saying, how much longer do you think it's going to be? And the answer was, soon. But that soon became 2 hours. And I think it's fair if someone's going to be delayed that much to say, we think this is going to be an extended time. Would you like to go get a cup of coffee and come back? Right? So just letting people know, or maybe this is going to be 2 hours. Do you want to reschedule? There was an emergency. We're going to talk about looking at the computer, but unfortunately, healthcare providers have a lot of documentation to do, and it's a bit of a juggle to figure out how are you going to do that documentation and pay attention to your patients. So it's really important to look at your healthcare as a partnership and working as a team, because this is going to have impact on your health. And that's what I'm hoping to put forward today. So let's start out with, you are looking for a new healthcare provider. How do you choose? How do you figure out, what is these soups of letters? So what's the difference between an MD and a DO? An MD is a medical doctor, and a DO is a doctor of osteopathy. And you may see those letters after your physician's name, and you're not sure what it means. It's the difference between what's called allopathic, MD, and osteopathic medicine. So traditionally, osteopaths were trained in more musculoskeletal bone manipulation. Often they become orthopedics, rheumatologists, physical medicine doctors, but not always. So their training, undergraduate training, is a little different, but they go on to do the same residencies. They do have to get board certification in the same way. So don't shy away from that DO if that's something a specialty where you're looking at somebody and they fit what you need. What about NPs and PAs, so nurse practitioners and physician's assistants? These are licensed independent practitioners, okay? So they may be used in your doctor's office to assist in visits, or as follow-up visits, to return phone calls. They are working under their own license with the supervision of a physician. They can prescribe, they can make assessments, but they work under the supervision of a physician. You need a new primary care physician. Internal medicine, family practice, should I see a geriatrician?
Not cool.
So internal medicine or internists are trained in the medicine of adults. That's what they practice. It's usually 3 years. If they choose to go on and do a specialty, whether it's cardiology or geriatrics or gastroenterology, it's anywhere from 1 to 3+ years of additional training. They have to take boards that certify them through the American Board of Internal Medicine that make sure that they have a knowledge base that that the board finds acceptable, and these boards are usually renewed every 3 years, so they have to take exams every 10 years rather. I'm sorry, every 10 years. Same with family practice in terms of certification, but family practitioners are trained in internal medicine, pediatrics, OBGYN, surgery, so they get a smattering of lots of different specialties. They can go on to do subspecialty training the same way in medicine subspecialties like cardiology or geriatrics. Their board certification comes from the American Academy of Family Practice, not the American Board of Internal Medicine. And you may see a lot more family practitioners out there doing rural medicine, but they may be local as well. Geriatrics is medical care for the older adult. So what's an older adult? Well, I guess because Medicare used that 65 plus, originally geriatrics was felt to be 65 and older, but we're finding that it's probably now 75 because that 65 plus to 74, 75 are still very active in the workforce and less likely to have those complex issues that we look at in geriatrics. Geriatrics is trained to deal with not just the screening and prevention and health maintenance of older adults, but to deal with the complex issues that occur, which may be cognitive impairment or dementia, frailty, recurrent falls, polypharmacy, taking too many medications, incontinence, and to work within a team, an interdisciplinary team, and work with caregivers to address these issues. And we'll come back to that. You're looking at picking a provider, look at your insurance. Make sure that the person you pick, your neighbor recommended somebody, and you make an appointment, but you didn't check if they took your insurance. And now you're stuck with a pretty large bill. So you want to make sure that the providers you're picking accept your insurance. Most older adults, especially those that are not part of the workforce and have commercial insurance, will have Medicare. But Medicare comes in 2 flavors, straight Medicare and Medicare Advantage plans. So there may be some offices that don't take your Medicare Advantage plan, like Aetna Medicare, Cigna Medicare, Humana Medicare. So you want to check, and you want to check because those plans may have what's called closed networks, that you must see somebody within their network to get any kind of reimbursement. I'm often asked about concierge medicine. What is concierge medicine? What is this move towards concierge medicine? Providers that choose to do concierge medicine ask for like a membership, a concierge fee to be part of their practice. I've seen it be anywhere from $3,000 to $4,000 to $10,000. And they feel that that's a fee that they're using to provide additional services and follow up with their patients. Those concierge physicians may or may not take insurance for your individual appointments. I'm going to reserve comment about what I think about concierge fees. I'm just sort of explaining to you what it is. Specific qualifications. Do you prefer a male or female physician? Do you prefer someone who speaks a specific language? Gee, you have a cardiologist who's affiliated with Hospital X. Maybe you want your primary care provider to be affiliated with the same hospital to facilitate care coordination and communication. So identify your options. Consult resources. It's okay to look for reviews online, but beware, okay? We find that sometimes people who do Google reviews are the people who are dissatisfied, and the people who are most satisfied might not necessarily complete those reviews. Many practices send out surveys in the mail or via email to patients to fill out after a visit. And I recently asked some friends at dinner, I said, when you get those, do you fill them out? And I got a lot of, I throw them in the garbage, unless I'm angry, which means that the negative reviews are what's getting there. So I encourage people, if you're happy, fill out those reviews so those positive comments get out there. They're really important. I now fill out every single review that I get. Why and when a geriatrician? So a geriatrician isn't going to necessarily see every person over the age of 65 or 75, right? Remember that more than 12% of our population is over the age of 65, and the 85 plus population is the fastest growing segment of our population. We geriatricians couldn't possibly see all of those folks, as there are only 8,000 geriatricians right now that are board certified nationwide. Not enough. We hope to be training more and also giving other specialties some expertise in geriatric medicine so they have that basis. But think about a geriatrician if there are significant impairments or frailty, including cognitive impairment, recurrent falls, multiple diseases that need coordination between many healthcare providers, as well as the support that may be needed for family members and caregiver stress. These are areas where a geriatrician and their team may be very helpful. Geriatricians also look at things a little bit differently, and we sort of use a rubric of what's called the 5 M's of geriatrics, focusing on mind, mobility, medication, multimorbidity, which means multiple disease process, and what matters most to the person. So it means individualized medical care, because what matters most to one person may not be what's important to somebody else. So this is just a teaser about geriatrics. So you're making that appointment, you've picked a healthcare provider, you're now calling. Consider when you're making those appointments. Timing. You get an appointment for 6 months for a new patient. Is that okay? Well, maybe it is. Maybe you're going to stay with your current doctor who's retiring, but not yet. And so that's okay. But maybe you need to be seen sooner, and that 6-month appointment is not good. Is that office accessible? So I have patients who come to me in my lower Manhattan office from the Bronx, and then they can't get there. And so they cancel appointments. So is it reasonable to make an appointment where you have a significant transportation issue? So what's the location? Is that location, you use a wheelchair? Is it handicapped accessible? Right? Do you need someone to go with you, whether it's a family member, a caregiver, a companion, and are they available to go at the time of your appointment? You know, patients are given a 9 a.m. appointment, but they say, my home attendant comes at noon. Well, then that 9 a.m. appointment is not going to work if they need someone to assist them. How long is my appointment going to be? Right? I have found this a few times where people, you know, coming for a new appointment, even though they're told it's a 1-hour appointment, they set up their ride to go home. Their appointment is at 10 o'clock for 10:30 to pick them up. The appointment is not even over, and we don't get finished doing the assessment. And then you might want to ask about after hours and emergencies. How do you contact the office? How is it handled? Is there an answering service? So these seem like a lot of questions, but they're going to make it easier for you to get good medical care. What type of visit? So we talked a little bit about new patient visits, right? So those tend to be longer. We'll talk about what to bring with you for those appointments, but maybe you're transitioning from another provider or a subspecialist thinks that you need a primary care physician who is going to coordinate your care. Medicare wellness and annual visits, and this is really confusing. Medicare allows for straight Medicare, not these Advantage plans, a Medicare annual wellness visit. This is a screening and prevention visit where there is no copayment, but it's not a physical. The point of that visit is to go through what screening tests you might need, your immunizations, habits, safety issues, and it might be tagged on to a regular follow-up visit once a year, or it might be done independently. Medicare Advantage plans and commercial insurance allow for an annual physical with no copayment. So you have to be a little careful when you're asking for that, what you're really looking at. And then there are those follow-up visits, which are for chronic care, maybe following up your diabetes or your high blood pressure that are happening throughout the year, or urgent visits. You have an acute problem, a urinary tract infection, a cough, a rash, and that's an urgent visit. And it's important to differentiate why you're making the visit, because if you're calling and saying, I have a rash and I would like to see the healthcare provider, they're going to address the rash. They are not going to necessarily talk about your chronic knee pain. Right? So it's a little bit different if it's an urgent visit versus a follow-up visit. Help, I can't get an appointment. So I've heard this time and time again. I called and they gave me an appointment to see you in 3 months. My question is then, well, you have an urgent problem. Did you tell them it's for an urgent visit? No. Did I have to? Yes, because there are often slots that are held in providers' offices for urgent issues versus follow-up, which is why it's important to differentiate. It's an urgent issue. The nurse practitioner will see you and will collaborate with me. Oh, so now you're going to get seen tomorrow, not in 3 months. So really important to make sure that you know, maybe there are no urgent visits available. They're all filled up, but you still need to be seen. Then your provider might help facilitate a visit at an urgent care center or tell you that that's important. So that's why it's important to differentiate what your needs are. Should you do telehealth or go to the doctor's office? So in 2020, the pandemic really made it necessary for telehealth visits for people to address both their follow-up needs as well as their acute needs related to COVID. And this really revolutionized our care of patients. We were allowed to continue providing adequate medical care without exposing people coming to the office. So it's continued and it's great. And I was talking to Matthew a little bit earlier that I was really, pleasantly surprised how many older adults adapted to doing telehealth. These were people who said, nope, I don't text, I don't do email. And suddenly they're now doing telehealth visits with us. And it was wonderful. But we have to pick and choose what things we're using telehealth for and how we're using it. And so we'll talk a little bit about that. But telehealth means doing a telehealth visit with a practitioner. I want to remind you, Dr. Google is not telehealth. So the benefits of an in-person visit. Face-to-face gives me a lot of information. I can see people's posture, their stance, how they're sitting there. I think it develops a very different relationship. I can do an actual exam. Someone has abdominal pain. I can feel their belly and see what's going on. I can listen to a heart. I can get the lab tests on site. It may be a lot easier for people with disabilities. So especially hearing and visual disabilities, to do that in-person visit. For some disabilities, telehealth may work better. And there's no technical ability or access to technology needed. So for some things, this is the way to go. But there are benefits to telehealth. So often it improves access to care. It's hard for you to get to the office. It's snowing out, but I still want my visit. Can it be a telehealth visit? And it might, that rash may be quite appropriate for a telehealth visit and minimizes unnecessary visits to the office and travel costs. It's very easy for family members who may not be local to join those telehealth visits. They can be sent a link as well. For people who live in remote areas or rural areas, it does increase access to subspecialists. Sometimes decrease wait time for appointments because there are slots for telehealth appointments. And certainly the reason that this really took off was decreased exposure to infectious illnesses. Telehealth or telemedicine might be very appropriate for things like a cold, a headache, mild diarrhea, constipation, nausea, vomiting, a urinary infection, low-grade fever. Follow up of your high blood pressure or your diabetes or medication refills or rash, but not necessarily the right thing if you've fallen and broken a bone, you have a burn, you have severe new pain like abdominal pain, chest pain, you should be calling 911, difficulty breathing, stroke symptoms, you should be calling 911, or high fever. So again, we have to look at what's going on to decide what's appropriate. And often, like if you call our office and you get our access center and you say, this is my complaint, they put you through to a triage nurse, and the triage nurse will say, no, you need to come in, or fine, we can set you up for an urgent telehealth appointment. How can you access telehealth? It's gotten really easy. You need a device that has internet access, a smartphone, an iPad, a tablet, a computer, and you need Wi-Fi. And that's pretty much it. Your provider might send a link, like a Zoom link, or it may be done directly through the medical record where you click on to the link. Can you use FaceTime? No. FaceTime is not a HIPAA compliant platform, which means that your information is not protected. And we're going to talk about protecting information. So when you say, can't we do it on FaceTime? The answer is really no. I wonder if people might want to put in the chat what their experience with telehealth has been. If anybody has any experience, and let's see if I can get back to seeing that chat. Somehow, there it is. Anybody have any thoughts about their experience with telehealth and if it made a difference, if they've used it? So I personally have used telehealth when I had COVID, I used telehealth. So yes, I also used telehealth for COVID-related illness, for therapy, and it was really convenient and effective. Yeah, so a lot of mental health providers are using telehealth, and it's improved access, really improved access to care. It decreases travel time. If your provider is not local, one caveat about telehealth. is, like if I'm doing a telehealth visit, I'm licensed in New York State. I can only see people who are in New York State. So if you are vacationing in the Catskills, no problem. We can do a telehealth visit. But if you are vacationing in Florida, you can't do a telehealth visit with a practitioner who is not licensed in Florida. So during the pandemic, many states had reciprocity and gave us temporary privileges. So I had both temporary Connecticut, New Jersey, and Florida privileges. So if my patients were somewhere else, I could still do it. Downside to telehealth was when the practitioner couldn't connect, and it took 4 times. So I think this has gotten better. We've gotten better at it, but sometimes there is a connection problem. I know that our office, sometimes there were glitches through the medical records, and now we can directly send through our medical record a Zoom link that is HIPAA compliant. Follow-up doctor missed the telehealth appointment and called me 90 minutes later. Oh, I'm so sorry that happens. So we'll talk about, how to prepare for telehealth visits, but just like an office visit, a doctor might be running late, but there's an obligation to let you know. And if you're waiting and someone doesn't let you know, then send a portal message, call the office saying, I'm here, where are they? Because, there can be circumstances that cause them to be delayed as well. Sorry, 1 second. So you're preparing for your appointment, whether it's a new appointment or a follow-up appointment. If it's a new appointment, you may be sent a set of forms to fill out. And if you can't do them electronically, ask for them to be mailed to you, or ask if you can fill them out at the appointment. And if you're going to fill them out at the appointment, make sure that you leave ample time. So your 11 o'clock visit, if you can't fill out those forms before you get there, you may need to get there 15 to 30 minutes before your appointment. Do you have prior medical records? Really important. I saw a new patient yesterday with one of my fellows who has numerous providers outside of our system. Came in and wanted an assessment for something. Didn't bring any records, said, oh, but I had blood work done. I don't want blood work. Oh, I had an MRI done. I don't think I need that. But we didn't have any of that. So if you bring that or send it ahead of time, you're ahead of the game. Someone has the ability to look and put together a plan a lot sooner. And if it's a follow-up visit and in between, excuse me, you've seen other physicians who are not part of the network that use the same medical record, bring copies. Bring your medications or a list. I personally prefer people bring those bottles because maybe they bring a list, but they didn't put down how frequently they're taking it. Or there's confusion about the dates. They bring a bottle and I see the last time it was filled is 2023. Why is it still on your list? Include herbals and supplements and over-the-counter medications because they can interact with your prescription medications. Contact information for other providers in case this new primary care physician wants to reach out. Think about bringing an advocate, especially if it's a new visit, if there are complex issues, if you think you're going to be getting some results and you want someone to take notes for you or process it. Because having additional eyes and ears can always be helpful. Talking about eyes and ears, please bring your glasses and your hearing aids to your appointments. It's really frustrating for everybody if someone's speaking to you and you can't hear them, and then a lot of information doesn't get transmitted appropriately. Know when you're going, what the goal of your visit is, because you may not get to everything on that long list. So what's most important to you? Similarly, when you're preparing for your telehealth visit, we ask you to be present on time. You may have to fill out some forms as you go through and register for your visit. You may be verifying your insurance information and so be prepared to do that. As I said, be available at your time, but know that your provider might be late, so be patient. I love seeing my patients' pets, grandchildren, birds, cats, but they can be distracting at a visit. So find a quiet space. Still prepare that list of questions and also any data you may have. You're doing this visit to follow up on your blood pressure after a new medication was started. You get on the visit and I ask, what was your blood pressure? Oh, I don't know. I didn't take it yet. Let me do it. Would be much more helpful and productive if you had that ready ahead of time. And are others joining? Are there family members who might be joining? If you're going to an in-person visit, remember, and I talked about this, time for registration and check-in, letting someone know if you have special needs or need an interpreter, asking about wait time, introducing yourself and any companion you have with you, and making sure that who's ever registering you or the medical assistant bringing you into the room, whether you want that companion to be with you the whole visit or not. Where's the restroom? This is a very important question. And whether you have any special concerns about the visit. Are you the caregiver coming with somebody to a visit? So again, introduce yourself. I always want to know, is this your son, your daughter, your home attendant, your neighbor? And if they don't, I ask, who's with you today? Would you like them to stay with you or do you want them to step out? Sometimes those caregivers provide really important information and I want to get information, but we have to respect autonomy and privacy and let the patient answer questions if they can. Certainly there are situations where someone cannot, severe cognitive impairment, strokes. But even with somebody with severe cognitive impairment, I ask them, what do they have something they want to share with me today? And I ask permission. Is it okay if I speak to your daughter and ask her some questions? As the caregiver, you might want to be the note taker and the one getting resources if the patient themselves can't do it. And if somebody is coming in with cognitive concerns, I just talked a little bit about balancing autonomy versus information providing. They may not be able to accurately report, and that's where a caregiver or a family member is very important. Bringing in that prior workup and testing facilitates the visit. And healthcare proxies. So someone who has cognitive issues who may not be able to speak for themselves, we as healthcare providers really want to know who is speaking for them and is there a document, a healthcare proxy, where the patient had appointed when they were able to someone to speak for them on behalf of medical issues. When you're giving information, please share all your symptoms. Don't pick and choose. You may not think it's important, but we may think it's important. So share them all. And I mentioned all medications, including those supplements and over the counter. Many a time I have found the person who came in saying, I'm very confused, or mom is very confused, that they were taking some over the counter cold preparation, which caused that confusion. Habits, smoking, alcohol, marijuana use. Since marijuana has been legal, I have found that more older adults are accessing it. And you need to share that with your healthcare provider. You need to share. More older adults unfortunately started drinking more during COVID. And sometimes I don't find out about it until I say, oh, why are your liver tests elevated? And I start asking about alcohol and find out someone is drinking 2 or 3 drinks a night. Be honest, right? Stay focused. So don't go off onto tangents. I love to hear about things my patients are doing at the beginning, like, oh, you're going on a trip. That's great. But if you have a half-hour visit, you don't want to spend 15 minutes of it speaking about your trip when you have a lot of medical issues to go over. So know those time limitations, and again, know your goals. There are these sensitive subjects that people often don't want to address, but it's really important. Sometimes memory is one of them. The family member brings memory up, but the patient themselves doesn't want to, or doesn't want to tell us that they've fallen because, my daughter won't let me live alone if she knows that I fell. Depression and anxiety or mental health concerns. We mentioned a little bit about alcohol and drugs. Sex and sexuality is very important to address in older adults. And if my patients are becoming sexually active or they have concerns, they need to bring it to me, because otherwise there may be things that aren't being addressed and that we can help make better. Incontinence, disagreeing with their healthcare provider. Patient doesn't want to take those lipid lowering medications, the statins, but they don't want to tell me because I prescribe them, so they're just not taking them, right? They're going to maybe a complementary or alternative medicine practitioner, or they're an herbalist. Again, they think it's not important. It's important. They didn't fill a prescription because the cost is too high and there's financial issues. So bring these forward to your provider so you can work on them together. Remember, you're a team. When you're getting information, okay, we talked about you giving information. If a test is being ordered, ask why. What preparation? My brother-in-law had to go for a test the other day, and he got there. After much ado, they get there and they say, but you didn't fast for 6 hours? We can't do the test. Nobody told him. But he also didn't ask. So ask, what is there any preparation that I need for this test? You're getting a new diagnosis? Ask questions. Did something cause this? Is there a treatment? What should I expect? Same with a new medication. Are there any other drug interactions or side effects that I should expect? Take the time to ask these questions. I want to bring up shared decision making. So what shared decision making means is you are a part of your medical care, and whether you're going to take a medication, do a test, follow through on a treatment. So for example, you're 80 years old and your doctor recommended that you have another mammogram. And you said, well, but I'm 80. I don't know if I want to do that. So then there's a discussion about what are the risks versus the benefits. What are the screening guidelines? Oh, your sister had breast cancer. Does that play a role in this decision? If something was found, would you accept treatment or surgery? Plays a role. This is shared decision making. You as a patient have choices, okay? Your own values, the circumstances around the test or the diagnosis, and are there other people who you want to involve in your decision? I had a patient last week with a new diagnosis of lung cancer. And when she was being, asked about treatment, she said, I don't want anything. And when I called her back after she saw the pulmonary doctor, and I said, do you want to know what the options are before you say that? And she thought about that. I said, maybe bring your sister with you. And then she agreed to see the oncologist. And we sort of framed it of, you're going to understand and to find out what the options are. The choices are still yours. And to that end, I want you to let you know about a website called myhealthpriorities.org. And this is a place where you can identify health priorities. Look at this, look at it with a family member or a caregiver, and share it with them. As your visit ends, repeat what you are told. So very specifically. So you want me to start this new blood pressure medication. I take it every morning, and I'm supposed to take my blood pressure 3 times a week and let you know at the end of 2 weeks what those blood pressures were. Repeat what you're told. Make sure that are you getting written information? Most offices will now give you written information. Find out if you get home and have questions, how do you communicate those questions? How are you going to get your test results? And when should you be seen again? I have to put this in there is also bring up vaccines if your provider didn't. Oh, do I need another flu shot? Are my vaccines up to date? I don't remember. There are lots of questions about repeat COVID vaccines. Do I need another measles vaccine? What about that new RSV vaccine? It's a good time to ask the questions. Questions, great place to ask them if you're out of that visit, is your patient portal. This is a picture of the Mount Sinai My Chart patient portal, or My Mount Sinai. And it's a place that a patient can 24 hours a day access their health information. Their lab tests, even before I see them, they're released to the patient. Sometimes not such a good thing because they don't understand the results. And I come in 9 o'clock the next morning and there's a question. What does that mean? But these are here for you, including your immunizations and your medication lists. And under messages, it's a great place for you to communicate with your provider. This was a flyer from the National Institute on Aging, and I was shocked when I saw it. Talk with your doctor, tips for seniors. You have only 18 seconds. That's an average time a doctor waits before interrupting a patient. So communicate and be prepared. I paid attention to this when I saw this. So when I go into my visits, I tell my patients, before you start speaking, let me do 2 things. Let's go through your medications and your vaccines. That way I've done my housekeeping. And then I say, now tell me what's on your mind at the top of your list, and then I'm going to go through my concerns. And that way I make sure that they're heard. Other situations. So where you're going to a healthcare provider, and I'm just going to address a few of these. So you're referred to a specialist. You're referred to see the cardiologist because your primary care physician heard an irregular heartbeat. You call to make that appointment and you can't get an appointment. Ask your primary care provider to facilitate it. Ask them to give you other options. Maybe the name of the doctor in that practice, they only gave you one name, but there's another person available. So when you're calling, say, well, is there anybody else who can see me sooner? Right? And sometimes seeing one of the trainees. So patients can't get an appointment with me, but they can see me with one of my geriatric fellows. And that's okay too. That gets them in sooner. So making sure that information, if you're seeing a specialist outside of the network that your doctor is in the medical record, that you bring records with you. You're being referred for that irregular heartbeat, but you decided that you're going to go to the cardiologist that your husband sees, but they're not part of this one, the network you're in. They're part of a different hospital. That's fine, but take the records with you. You need to go to the emergency room where you think there's some emergency going on. As long as you're not having chest pain, severe difficulty breathing, or signs of a stroke, which means it may be inability to speak, a sudden visual problem, numbness or motor weakness in an arm or a leg or a part of your body, those are 911 calls. Call your provider's office. Speak to somebody, say, what do you think I should do? Should I go to the emergency room? Can I come see you? Should I go to urgent care? because we don't want to send you to an emergency room if you don't need to go, right? So your doctor's office may be able to manage it, even if it's on nights and weekends. If they have coverage, call and ask the question, can this wait till Monday? Do you think I can go to an urgent care center that can address it? So that way you are directed to the right place. Often it's beneficial if you do have a choice to go to the emergency room affiliated with your doctors. So again, medical records are shared. A social worker I worked with a number of years ago developed this just in case folder idea. And I've used it many times, and I think it's really a great thing to have. Make a folder, include your health insurance cards, medication lists, list of medical problems and these allergies. This may all come out when what you're given from your last doctor's appointment. The name and phone numbers of all your healthcare providers, a copy of your healthcare proxy, and family contact numbers. And you may say, well, this is on my phone. Do I really need to do this? It's great to have it on your phone. Having all the list of medications on your phone and a copy of your insurance card, it's great. But having a paper copy, believe it or not, can still be beneficial. A number of years ago, my mother-in-law, well, her home attendant called 911. They thought she was having a stroke, took her to a local hospital in another borough. She didn't have any of this information with her. The ambulance came, swept her away, and I had a just in case folder with all her information sitting in my house. But we left the house in a tizzy, so I didn't get it. But I was able to call a friend and tell them where the folder was and to bring it to us. So whether you keep this, your family member might want to keep a folder like this on their computer where they can print out the information at another time. But this is a great thing even for your caregiver, if you have a home attendant, to have access to that folder so they can take it when they're going to an emergency room. I mentioned this a little bit. Is your personal health information secure? So telemedicine appointments and electronic medical records are subject to HIPAA compliance, which means patient security. And so we can only offer you secure technology for medical record information. This is why no one's going to email you your medical records on an unsecure email, and why we're not going to do FaceTime. Just a word about the health of caregivers. If you are a caregiver, please don't neglect your own health, because you can't be an effective caregiver if you are ill. So make sure to take care of your own immunization, screening, and prevention. If you get the flu, you're not going to be able to take care of somebody else, and you also risk giving it to them. Caregiver stress is real, okay? It affects anxiety, depression, sleep, your chronic illnesses. Please accept help. Join a support group if you need it. So to sum all this up, getting regular health care is important, and you need to be your own advocate. You need to speak up for yourself. You need to know what the goals of your visit are, to choose your primary care provider carefully so they fit your needs, and prioritize at your visits. Remember, not everything is going to be able to be covered at every visit. Know what you need as you go in, and develop a relationship with your provider of mutual respect. If you ignore your health, it will go away. So please don't ignore it. And just for a little fun, because as you get older, you can still be functional and productive. And so some of my sort of favorite older people, actor George Burns won his first Oscar at 80. Ruth Bader Ginsburg was on the Supreme Court till age 87. And Albert Schweitzer was still performing surgery at age 89. So with that, I'm going to stop sharing my screen and accept any questions from anybody.
Yes, please unmute yourself if you want and ask a question, or you can just put it into the chat. Thank you so much, Dr. Fogel. This was fascinating, and there's an awful lot of information in there that you presented us today. I do have a question. This might be a little bit off topic. If it is, just tell me. But I hear a lot now about insurance companies basically second guessing doctors. And how is that affecting patients? Is this something they need to know about?
Yeah, so um, I think that concern often comes up a lot with Medicare Advantage plans, where you need prior approval for certain things. So your doctor sees you and says, I think we should get a CAT scan of your abdomen. And now your insurance company says, I need documentation of why. Did you do X, Y, or Z first? Right? So sometimes it's justified. It's easy. Yes, here's my note, and here's the abdominal x-ray we did, and then they approve the CAT scan. Sometimes who's ever reviewing it may say, no, I don't think it's necessary. And then we have to go to bat for you. And I will say that 99% of the time we win. We call the insurance company and we do what's called a one-to-one with a physician at the insurance company and explain why we think we need that test. It's very time consuming.
Yeah,
And I can't speak to what's done at other practices. In
right.
our practice, we're pretty aggressive about saying, no, I want this test and I'm going to get it.
Okay.
So yeah, it is sometimes a little difficult. And sometimes people choose, why does somebody choose a Medicare Advantage plan? Maybe cost, maybe that it's offering them services that straight Medicare doesn't. Someone wrote in the chat, I requested my medical records from specialist's office and they never sent it. They said someone would get back to me, but nobody did. This has happened twice. So they didn't request it on the patient portal. Good point. Requesting it on the patient portal is great because it's documentation that you requested it. You may have called, spoken to somebody, and they didn't get the message, right? But I would recall and request it again. Sometimes you may have to put it in writing, but the other thing you can do is send a message on the portal directly to your primary care provider and say, I need these records, and they can direct them. So within our practice, if somebody just wants the last note or some labs, that's easy. We can do it. If they say, I need my entire medical record because I'm moving to Florida, then we actually have to send that to our medical records department because that's a lot of information to duplicate and send out. So it depends on what you're requesting. Someone put in, I had great experiences with your fellows. So for people who don't know what fellows are, let me explain. So after somebody has done training in either internal medicine or family practice, and they choose to do a specialty, they do additional subspecialty training, whether it's in geriatrics or cardiology. So we have fellows who train in geriatrics for either 1 or 2 years. So they are already completed their training. They could be out there in training. So people say, well, they're not real doctors. They certainly are. They could be out there practicing, but they choose to get additional training. And they're doing that under the supervision of one of the geriatricians. So it's extra sets of eyes. And it's a learning opportunity for them as well as for you, because, I find like I'm in there talking to my fellows and the patients are learning at the same time. So don't shy away from our fellows are amazing. Don't shy away from seeing them. Any other thoughts or questions? So someone put in a comment before about good experience with follow-up for telehealth when no hands-on exam is needed. Agreed that if you don't need a hands-on exam, it actually works well for all of us Because if all I am doing is reviewing your blood pressures that you took at home, I don't need to have a hands-on exam. So I think that it can be a very good option, but not always.